very much, Claire, and I have to say that Claire is a very active member of DPAC as well. So, Disabled People Against Cuts, which we know as DPAC, was formed by a group of disabled people after the 3rd of October 2010 protests against cuts in Birmingham. That was at the Tory Party conference in 2010. That was for the purpose of defending welfare and benefits for disabled people and highlighting how we are very much not all in it together. Groups like disabled people aren't only disproportionately affected by cuts, but we've also been made the target of some vicious attacks by the government. The 3rd of October saw the first protest against the austerity cuts and their impact on disabled people under the name of the Disabled People's Protest. The leaders of that protest went on to set up DPAC, which is now a national campaign with local groups. We've got a very active Brighton DPAC group, supported by people who believe that disabled people should not be the scapegoats for the financial mistakes of governments, that disabled people should not be constantly told by millionaire politicians that there's no money to support us, that disabled people should not tolerate further erosion of our living conditions or our human rights. We won't sit quietly while they try to take our rights away. We'll go and blockade Trafalgar Square. Things were bad enough for disabled people before this government and before the current attacks. With disabled people twice as likely as non-disabled people to be unemployed, and for those of us in employment, we do face discrimination on a very common basis. Disabled people are much more likely to be poor. Half of the 12 million disabled people living in the UK live in the poorest households with incomes of no more than £250 per week. Nearly 68% of disabled people need state benefits, compared with 33% of non-disabled people. Nearly half of disabled people live in unsuitable housing and have difficulty accessing rooms or leaving their houses. Some groups of disabled people, namely people with learning difficulties and mental health survivors, die on average 10 years earlier than non-disabled people. And that's not because of anything to do with our impairments, that's because of lack of access and treatment by the NHS. In 2006, the MENCAP report, Death by Indifference, told the story of 6 people with learning difficulties who died through neglect while they were in hospital care, because their needs as people with learning difficulties simply weren't being met. So that was 2006. 5 years later, MENCAP did a follow-up report. This time it had the deaths of 74 people with learning difficulties by neglect in it. With what's happening to the NHS now, we can only assume that that situation is actually going to get much, much worse. Prejudice against disabled people is so bad that bullying, harassment and hate crime are everyday occurrences. The Equality and Human Rights Commission did a report last year, Hidden in Plain Sight, and that detailed how common disability-related harassment is. But it also documented the torture and murders of 10 disabled people, mainly people with learning difficulties. When interviewed, the perpetrator said things like, the person's life was worthless, and I don't want to go down for having killed a muppet. That's the view of society on the lives and what the lives of disabled people are worth. So things were bad enough already. The past government set a target that by 2025, disabled people would have full equality. Now, at the time, I remember disabled people were all saying, we can't wait 20 years, we need it now, we need equality now. But actually, even then, 2025 was an ambitious target, given the multiple barriers that disabled people face. Now, instead of working towards equality, the Condon government is deliberately stripping away the rights and entitlements that disabled people have fought so hard for over the past few decades. A veteran campaigner, a good friend of mine, has been quoted as saying, I've just wasted the last 27 years of my life. Everything we fought for, they're now taking away. Disabled people are predicted to lose, at the very least, £9 billion in benefit entitlements over this Parliament. 500,000 disabled people will lose disability living allowance when it's replaced with personal independence payments. DLA is essential funding to cover the high living costs of being disabled. One survey found that 57% of disabled people who are working and currently on DLA said they would have to stop working if their DLA was cut. So this is one of many examples where government policy doesn't actually make economic sense. The cuts they're bringing in to disabled people's benefits are going to cost more in the long run. Then there's a situation with employment and support allowance, which I know Brighton DPAC has been quite active in campaigning against. ATOS continue to run the notoriously flawed work capability assessments, for which they receive £100 million a year from government. Tests that are so unethical, the British Medical Association has raised concerns. The inaccuracy of these so-called assessments have resulted in many of the decisions being overturned at appeal, at a substantial cost to the taxpayer and a substantial human cost to those who are being subjected to the punitive process. The success rate at appeal stage is about 40%, and for those people lucky enough to have representation, that figure rises to about 70%. DPAC receives emails daily from disabled people who are thinking of taking their own lives, and from those who say that they have failed to qualify for employment and support allowance and then failed to qualify for job seekers allowance. And that was actually the situation of Helen Mullins, who her and her husband killed themselves at the end of last year in Bedfordshire. Helen had mental health problems and learning difficulties. She was found fit for work by ESA, so she lost that, but then because she was illiterate, she couldn't qualify for job seekers allowance, so they were just living off her husband's benefits. And they struggled so much that in the end they decided to take their own lives, sadly. So we're seeing situations where disabled people don't have any income, they're losing their homes, losing their children, and they're left to rely on handouts from relatives and friends in order to exist. And this is not something that should be happening in one of the richest countries in the world. These people have often worked for many years, paid national insurance to protect them in illness, sickness and disability. It's not a lifestyle choice. Disability claimant fraud is the lowest of all welfare fraud, with much of it being administrative error. The fact that the government has targeted a group of people that the welfare system was set up to protect is a clear breach of all existing human rights legislation. The fact that ATOS are paid £100 million a year to administer these assessments by the DWP is a clear breach of logic and mathematics. The Independent Living Fund, the ILF, has been closed to new applicants since December, and the government is proposing to transfer its functions for existing claimants to local authorities, but there's no explanation coming from them when we question them about how that can possibly work, given that the ILF manages to run with overheads that are as low as 3% of its total budget. If you're going to transfer the ILF budget to local authorities to administer, local authorities take up a much bigger percentage of your overhead, so how that's going to work, nobody's given us an answer. Plus, of course, local authority care managers and adult service teams are already overstretched beyond capacity, as survey after survey has shown. The ILF is used by relatively few disabled people, say under 20,000, but it has huge significance for disabled people's position in society because it enables those with the highest levels of support need to live in the community, whereas in the past they would have been confined to institutions with no choice over where they lived, how or with whom. Additionally, we're seeing huge cuts to social care budgets, increases in local authority social care charges, and huge cuts to voluntary sector services, with 1 in 5 deaf and disabled people's organisations in London expecting to close this year. The end to legal aid for welfare benefit cases also disproportionately affects disabled people, because 56% of all legal aid welfare benefit cases come from disabled people. So disabled people will unfairly lose their benefits and then not be able to have any help to appeal against the decisions. The impact of these cuts is tragic and cruel. We know of disabled people who've died or taken their own lives in despair due to loss of benefits. Just last week I met a woman at the TUC Disability Conference who described herself as an ATOS victim, and she said to me, I've come to the conclusion I've got two choices. 1, kill myself. 2, go and create fucking mayhem. So I tried to persuade her to do the mayhem and not killing herself a bit. Without the income or support we need to live in the community, disabled people will be returned to institutions and denied basic human rights. Already local authorities such as Worcestershire and Newcastle are introducing caps on social care packages and offering as an alternative for disabled people with higher level support needs to go into residential care, effectively taking away their right to live in the community under the UN Convention of Rights of Disabled People. So disabled people aren't just disproportionately affected by austerity, they're also being deliberately targeted. The government are making disabled people scapegoats for the financial crisis. They're saying we are the problem. The work capability assessments are based on a way of understanding disability called the biopsychosocial model, which was developed in a university department in Cardiff University, funded by the insurance company Unum. The biopsychosocial model basically says that disability is in our minds and we could do a lot more if we just tried a bit harder. The social model of disability has been a very effective campaigning tool for disabled people's rights for the last 20 to 30 years. So the threat of this new model is actually immense for disabled people's rights. And how are they getting away with it? Well, the government are using the press to make the public think everyone on benefits is a benefits scrounger. And this has led to a marked increase in harassment of disabled people. Whilst it becomes ever harder for disabled people to access benefits, the media and government continue to purposefully encourage this perception of widespread benefit fraud, failing to mention incapacity fraud is just 0.3% of spending, or the estimated 16 billion of benefits that go unclaimed each year. In a letter from Anne Begg, chair of the Commons Work and Pension Select Committee, to Chris Grayling, Minister for Employment, last year, serious concerns were raised about the misuse of benefit claimant statistics and the government's role in inciting media misrepresentation. The range and depth of these attacks against disabled people clearly show we're not all in it together. The fact that these so-called austerity measures don't make any economic sense shows that the attacks are ideological. They're about stripping away the welfare state and those people who depend on it. The erosion of the welfare state has enormous implications for disabled people because in a capitalist society where people are valued according to their worth in the competitive labour market, disabled people can only have equal life chances with state intervention and support. Well, what can we do? Disabled activists are starting to rethink our position on things like personalisation and how that's led to marketisation and privatisation of social care services. And Remploy is actually another one we're rethinking our position on and actually supporting the workers this time. We're starting to work with mainstream anti-cuts groups and campaigns. We're even building bridges with trade unions. And most of all, we're not lying down and accepting the attacks. We're coming out together and we're fighting.